Hello and welcome to another episode of Podcast DX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
And I'm Ron.
And I'm Jean Marie.
Collectively, we're the host of Podcast DX. On today's show, we're going to be talking about tinnitus.
Okay, tin items, tin cans, soda cans.
No. Tinnitus, not tin items.
Lita's missing her front teeth, and I didn't quite catch that.
God, we got to talk about the front
I'm
teeth.
sorry.
All right.
Okay, so tinnitus, it comes from the Latin pronounced tinere, which means to tingle or ring. And it's actually been in use since the 1840s to describe a buzzing or ringing in one or both of your ears.
That's right, Ron. And take it from somebody who's had tinnitus for more years than I can remember. For me, the noise is constant and no one else can hear it.
And if the issue is caused by a disturbance in, like, say, the jugular veins, there can be an actual clicking sound or clicking noise that an outside person can hear. For example, if a physician is using a stethoscope, they'll be able to hear that clicking noise that you're hearing inside your head. But that is a very rare type of tinnitus, and we're not actually going to be focusing on that type today. Instead, that would be called objective tinnitus.
Right. So today we will be discussing subjective tinnitus that, like Lita said, no one else can hear it other than yourself.
Right.
How common is tinnitus?
Well, it's thought that 1 in 5 people will experience tinnitus at some point in their lives. As we age, the chance of having some form of tinnitus increases. There are 4 types of tinnitus: subjective, neurological, somatic, or objective. The majority of individuals with tinnitus have the subjective form, which means that only they can hear the ringing, buzzing, or other sound.
Okay. And the type that Lita has, as she was saying, is subjective tinnitus. And the Mayo Clinic says that this is actually most often described as ringing in the ears, even though there's no external sound present. However, tinnitus can also cause other types of phantom noises in your ears, including buzzing, roaring, clicking, hissing, or humming. And these sounds may be perceived anywhere from a low pitch, like a roar, to a high pitch, like a squeal. And the noises of tinnitus can vary, and you may hear it in one or both ears. In some cases, the sound can be so loud that it interferes with your ability to concentrate or hear actual external sound. And tinnitus may be present all the time, or sometimes it'll come and go. Mom, yours is constant though, right?
Yes, all the time. However, there are good days and bad days. And on the bad days, I just say it's a loud day. Like today's a loud day, meaning that the ringing is really loud, almost to a point where it is hard to concentrate.
I'm sorry to hear that. I'm sure our listeners would like to know more about what causes tinnitus, and I'll start us out. I'm going back to the Mayo Clinic for research, and in many people, tinnitus is caused by one of the following: hearing loss. Inside your ear, there are tiny, delicate hair cells in your inner ear or cochlea, and they move when your ear receives sound waves. If you picture grass being blown by a breeze, it's something comparable to that. And this movement actually triggers electrical signals along the nerves from your ear to your brain, or auditory nerve, and your brain interprets these signals as sound. If the hairs inside your inner ear are bent or broken, for example, if you put on loud music on headphones, then it's like a tornado coming over those grasses, and they'll bend. And this happens when you age too. If you picture old grass, they're more brittle, or when you have you're regularly exposed to very loud sounds, and they can leak random electrical impulses to your brain, causing tinnitus. So it's as if those hairs are constantly receiving input when there's no input or there's no sound to be heard. Ear infections or ear canal blockage. Your ear canals can become blocked with a buildup of fluid if you have an ear infection, earwax, dirt, or other foreign materials, and a blockage can cause pressure in your ear, causing you to experience tinnitus as well. and that's something that would be dealt with by your physician. You shouldn't try to clear that by yourself. Head or neck injuries, the nerves are all connected, and if you have a head or neck trauma, this can affect the inner ear as well, and hearing, the nerves or the brain function linked to hearing. And such injuries usually cause tinnitus in only one ear. And then actually there's some medications that can result in tinnitus. A number of medications can cause or worsen your tinnitus. Generally, the higher the dose of these medications, the worse your tinnitus becomes. And often the unwanted noise disappears when you stop taking these medications. Medications known to cause tinnitus include nonsteroidal anti-inflammatory drugs, or NSAIDs, and certain antibiotics, cancer medications, water pills or diuretics, anti-malaria medications, and antidepressants. I would say consult your physician and check the common side effects.
Okay. The Mayo Clinic also lists other less common causes of tinnitus, including other ear problems, chronic health conditions, and injuries or conditions that affect the nerves in your ear or the hearing center in your brain. Meniere's disease. Tinnitus can be an early indicator of Meniere's disease, which is an inner ear disorder that can be caused by an abnormal inner ear fluid pressure. Okay, how do you say it? Eustachian tube dysfunction. In this condition, the tube in your inner ear, connecting the middle ear to the upper throat, remains expanded all the time, which can make your ear feel full. Ear bone changes, and there are a lot of bones in your ear.
Tiny little
bones. Stiffening of the bones in your middle ear may affect your hearing and cause tinnitus. This condition, caused by abnormal bone growth, tends to run in families. If you have muscle spasms in the inner ear.
And you don't typically think of
muscles in your inner ear.
Yeah, how do you strengthen them?
Yeah. Right. Or how do you get a massage in it?
How do you get a massage in the ear?
Muscles in the inner ear can tense up or spasm, which can cause tinnitus, hearing loss, and a feeling of fullness in the ear. This sometimes happens for no explainable reason, but can also be caused by neurological diseases, including multiple sclerosis. TMJ disorders. Problems with TMJ, or the joint on each side of your head in front of your ears, where your lower jawbone meets your skull, can cause tinnitus. Acoustic neuroma or other head and neck tumors. Acoustic neuroma is a non-cancerous, which is benign, tumor that develops on the cranial nerve, and it runs from your brain to your inner ear, and it controls your balance and your hearing. Other head, neck, or brain tumors can also cause tinnitus. Blood vessel disorders, conditions that affect your blood vessels, such as atherosclerosis, high blood pressure, or kinked or malformed blood vessels, can cause blood to move through your veins and arteries with more force. Picture having a hose and you bend it, so then you got more force coming out of the end of the hose. Right. These blood flow changes can cause tinnitus or make tinnitus more noticeable. Other chronic conditions like diabetes, thyroid problems, migraines, anemia, and autoimmune disorders such as rheumatoid arthritis and lupus have also been associated with tinnitus.
And I think this kind of makes me more aware of this fact, but if you have something and you think it's kind of a minor thing like ringing in your ears, it may be caused by something significant and maybe an early indicator.
Right.
Yeah, so you want to make sure you annotate that and let your healthcare provider know.
Yeah, and if the news can't get any better, guess what? Anyone can experience tinnitus, but there's some factors that I'll go over in a minute that may increase your risk.
Okay.
Exposure to loud noises.
Like when we were kids and we went to concerts?
Something like that, yeah.
We were kids once. I was, anyway.
It's hard to believe.
But loud noises, such as those from heavy equipment, chainsaws, firearms, those are common sources of noise-related hearing loss. A lot of people don't know portable music devices, such as the MP3 players. They can also cause noise-related hearing loss if played loudly or for long periods. People who work in noisy environments, such as factory and construction work, musicians, soldiers, those folks are particularly at risk. Once again, age. As you age, the number of functioning nerve fibers in your ears declines, possibly causing hearing problems often associated with tinnitus. Sex.
I like sex.
Oh, good Lord.
I got nothing.
This is when I quit podcasting.
Let's try this again. Okay. Sex. Mm-hmm. Men.
Oh, I see.
Are more likely to experience tinnitus. That's kind of curious, but
yeah,
that's what.
Maybe you have larger bones in your ears.
I'm thinking it's a genetic link, but
okay.
Yeah.
Moving on, tobacco and alcohol use. Smokers have a higher risk of developing tinnitus, and drinking alcohol also increases the risk of tinnitus. And then certain health problems, obesity, cardiovascular problems, high blood pressure, a history of arthritis, or a head injury, it can also increase somebody's risk of getting tinnitus.
And those links were also from the Mayo Clinic?
You bet.
All right, I thought so. The National Institute of Health gives the following advice for treatment options. Tinnitus does not have a cure yet, but treatments that may help people cope better with the condition are available. Most doctors will offer a combination of the treatments below, or that I'm going to read, depending on the severity of your tinnitus and the areas of your life that it affects the most. I should probably go to the doctor about this. Mm-hmm. Look at there's solutions here. Hearing aids. Oh, Lord. They've been telling me I need hearing aids.
Yeah.
Maybe that would help.
Yeah.
Are often helpful for people who have hearing loss along with tinnitus. Using a hearing aid adjusted to carefully control outside sound levels may make it easier for you to hear. The better you hear, the less you may notice your tinnitus. Okay, well, that's an option. Counseling helps you learn to live with your tinnitus. Most counseling programs have an educational component to help you understand what goes on in the brain to cause tinnitus. Some counseling programs also will help you change the way you think about and react to your tinnitus. You may learn how some things that you could do on your own to make the noise less noticeable, to help you relax during the day, or to help you fall asleep at night. So I could talk to my counselor about it. All right. Wearing sound generators. Sound generators are small electronic devices that fit inside your ear and use a soft, pleasant sound to help mask the tinnitus. Some people want the masking sound to totally cover up their tinnitus, but most prefer a masking sound that is just a bit louder than the tinnitus. Oh, that would drive me nuts if it was louder than this. The masking sound can be a soft shh, random tones, or music.
So when mine's acting up, I just like to go to the library and start talking really loudly and be shh.
Golly. Tabletop sound generators are often used as a relaxation aid to sleep. And if you place them near your bed, and you can program the generator to play pleasant sounds such as waves or waterfalls, rain, or the sounds of a summer night. If your tinnitus is mild, this might be all you need to help you fall asleep. There are also acoustic neural stimulation. It's a relatively new technique for people whose tinnitus is very loud or won't go away. It uses a palm-sized device and headphones to deliver a broadband acoustic signal embedded in music. Do you get to pick the music, I wonder?
I don't know. Yeah, we'll have to look into that.
Okay. The treatment helps stimulate change in the neural circuits of the brain, which eventually desensitizes you to tinnitus. The device has been known to be effective in reducing or eliminating tinnitus in a significant number of study volunteers.
That might be something you should look into.
I find it hard to believe that anything could take care of this noise, but I will try. There'll be a follow-up episode for this.
What worked for Lita?
Yes.
Put it in the book.
Yes. Cochlear implants are sometimes used in people who have tinnitus along with severe hearing loss. A cochlear implant bypasses the damaged portion of the inner ear and sends electrical signals that directly stimulate the auditory nerve. The device brings in outside noises that help mask the tinnitus and stimulate change in the neural circuits. Antidepressants and anti-anxiety drugs may be prescribed by your doctor to improve your mood and help you sleep. Of course, they also said that antidepressants may cause tinnitus. So that's interesting. Other medications may be available at the drugstore or on the internet as alternative remedy for tinnitus, but none of these preparations have been proved to be effective in clinical trials.
Save your money.
Save your money.
And is there anything you can do to stop it from getting worse?
Noise-induced hearing loss, or the damage to the sensory hair cells in your inner ear, is one of the most common causes of tinnitus. So anything that you can do to limit your exposure to loud noise, moving away from the sound, turning down the volume, and wearing earplugs that are proper, or ear muffs like these, will help prevent tinnitus or keep it from getting worse. And just so you know, I've got earphones on, right?
Yes.
I got headphones on.
Yes.
And they kind of block a little bit of outside. I can still hear a little bit outside. But the ringing in my ears is the same volume no matter what we're doing.
I couldn't imagine that.
Yeah.
And that's why I talk louder than most people think I should be talking, because I'm talking over what I'm hearing.
Right.
Yeah.
Wow. Which is really kind of weird.
And it does seem like it's, I know I also have it from a head injury, and it's worse at night when you're trying to fall asleep, because you're not really, because
there's no other,
there's
no distractions.
You're constantly distracted.
Right.
There's constant noise. There's the neighbor's generator going off.
Right.
So you're constantly hearing noises, and then at night when you're trying to fall asleep, it's really prominent, and usually the house is quiet. So I know I personally have to listen to some music or something so that I can fall asleep.
Have you ever tried a diffuser? It's more for sensory with smell and all that, but there's like bubbling noises.
Oh, I have on my phone, I've got an app that has different kind of noise. I've tried everything.
Yeah.
I think the one that helps me the most is the rain.
Okay, right.
But there's different rains.
Sure.
And I have to actually go through the different rains to find one that helps a little. But nothing takes it away.
Right.
But it does help you think about, concentrate on that rain sound, which is a much more pleasant sound than this.
The ringing, sure.
It's not really ringing like ring. It's like, I wish I could do it.
Loud hiss or loud...
Yeah, I wish I could. And it's real high pitch.
Yeah, but it's hard to explain.
It is hard to explain.
Gotcha.
And when it's in the middle of your head, it's like, what do you do with it? All right. Anyway.
So, well, lastly, the American Tinnitus Association gives the following advice regarding what you were talking about earlier, noise-induced hearing loss. First and foremost, stay calm. Tinnitus can be very frightening, especially if it develops rapidly and without warning or without a clear triggering event. But it is important for patients with tinnitus to stay calm and not panic about their condition. Tinnitus is very, very rarely indicative of an underlying emergency or life-threatening medical situation. And in some cases, tinnitus may be an acute symptom that goes away after a few days or weeks.
That would be nice.
Yeah, I'm sure. But note that if your tinnitus symptoms were triggered by a traumatic physical event, such as a head or neck injury, concussive trauma, or something like that, you should immediately seek medical care to address any emergency medical conditions.
Right.
Great advice.
Yeah.
And we hope our listeners have learned a lot. And let's pass on some links for our listeners. So if you have any questions, we'll have some links for you.
Yeah, I think it's a good start for more information. Again, the American Tinnitus Association, found at ata.org. And of course, seeing your own physician is the only way to find out what is the cause and if there's anything that can be done for your particular tinnitus.
Thanks, Ron. Well, that wraps it up, except for the fact that I'm going to go and talk to my doctor about all these new things that came out.
Sounds good.
And if you have any questions or comments related to today's show, you can contact us at podcastdx@yahoo.com. We have a website, podcastdx.com. We also are found on Facebook, Twitter, Pinterest, and Instagram.
And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.